Hello there. Today we will be discussing the cardiovascular disease hypertension. Hypertension, also known as high blood pressure, occurs when the blood pressure in your blood vessels are too high, typically with the blood pressure reading of 140 systolic over 90 diastolic pressure or above. Often, people with hypertension may not feel any symptoms, and the only way to truly know if you have it is to check your blood pressure. Primary hypertension occurs when you have abnormally high blood pressure that's not the result of a medical condition. This form of high blood pressure is often due to obesity, family history, and an unhealthy diet. It can be reversed with lifestyle changes, including healthier eating, quitting tobacco, and being active. An independent risk factor for primary hypertension is age. Why does the prevalence of high blood pressure increase as a person ages? As we age, our heart and blood vessels function less well. Our kidney functions is challenged, and our neuroendocrine feedback is reduced. Most importantly, the elastic tissue in our arteries degrade over time.
People with very high blood pressure, usually 160 over 100 millimeter per mercury or higher, may have symptoms such as headaches, blurred vision, chest pain, dizziness, and many more. If lifestyle changes cannot reverse your hypertension, your physician may prescribe antihypertensive medications such as water pills, angiotensin-converting enzyme inhibitors, angiotensin 2 receptor blockers, and calcium channel blockers.
Can changing lifestyle habits or increasing exercise really improve blood pressure? A research experiment published by the Canadian Cardiovascular Society titled Impact of Yoga on Global Cardiovascular Risk as an Add-on to a Regular Exercise Regimen in Patients with Hypertension conducted a study to improve the cardiovascular health of individuals with hypertension.
The primary objective of the research study is to determine whether the addition of yoga to regular exercise training regimen can improve cardiometabolic health. The study recruited 60 participants diagnosed with hypertension and were enrolled into their exercise training program.
One cohort completed 30 minutes of aerobic exercise and 50 minutes of yoga, and the other cohort completed 30 minutes of aerobic exercise plus 50 minutes of stretching 5 times weekly for 3 months.
The result shows that after the 3-month intervention period, there was a decrease in resting systolic and diastolic blood pressure, mean atrial blood pressure, and heart rate in both groups. However, the decrement in these parameters was significantly greater in the yoga group. In addition, there was a significant decrease in LDL-C, TJ, glucose, HbA1c, hsCRP levels, and Framingham risk score in both groups. This decrement was not different between groups. This means that both yoga and stretching group improved lipids, blood glucose, inflammatory response, and coronary heart disease risk, in addition to improving blood pressure after the intervention.
The conclusion of the study was that the yoga group improved blood pressure more than the stretching group. However, for those who have hard time to complete the yoga, simply doing the stretching can also improve your blood pressure, lipid, and blood sugar. They can reduce the inflammatory response and the risk of coronary heart disease. The strength of the study includes the study differentiates yoga and stretching to prove the benefit of yoga over stretching, and control aerobic intensity by measuring heart rate. In the study, yoga routine was well described and could be easily replicated. The sample criteria has no significant difference of age, sex, smoking prevalence, body mass index, blood lipid, blood glucose levels, and the risk of coronary heart disease. However, there were limitations as there was no control group in the study, and exercise duration is too long for older adults, and it was hard to track whether they completed or not. The sample size was not large, and the data was collected from mostly women. The diagnosis of hypertension may be subject to an error. The use of heart rate as a criterion to control aerobic intensity is outdated. The study does not take into account an individual exercise capacity. At last but not least, the yoga group may have realized that they were the experiment group and may have made some changes to their diet and routine, which affect the result, that also known as a Hawthorne effect.
In conclusion, there are a few things you can do to prevent hypertension. Firstly, improving your diet, including lifestyle changes such as implementing yoga or stretching, improving your mental health such as mindfulness training, and regularly checking your blood pressure are all advised. If your blood pressure is too high, please consult a physician.